Recurrent miscarriage is defined as a woman becoming pregnant and having 2 or 3 pregnancy losses. The known causes of recurrent miscarriages are many, although the majority of them remain unknown but are felt to be chromosomal in nature and possibly due to a woman's age and possibly due to egg quality. Some of the other possible reasons of miscarriage include a uterine structural defect, such as scar tissue in the uterus, or a uterine septum, or a uterine fibroid. Other potential causes of miscarriage include metabolic reasons, such as diabetes and thyroid disease. Finally, additional causes of recurrent miscarriage include blood disorders, such as a coagulation propensity, which would cause someone to have an early clot in the pregnancy, interfering with the health of that pregnancy and leading to the pregnancy loss. Approximately 25% of all pregnancies result in pregnancy loss. However, with the newer and better technology that is able to pick up pregnancies quite early, we're finding that many women who just miss a period and who have their period perhaps a week or 10 days late are in fact experiencing a very early form of pregnancy loss. Miscarriage can be prevented if there are known causes to the miscarriage. For example, if someone has a clotting disorder and they are put on anticoagulants to prevent a clotting disorder, that is one of the most successful treatments to prevent miscarriage. When a woman presents to a physician for the complaint of recurrent miscarriage, the physician will take a very, very careful history and do an examination, and then usually order a panel of testing to investigate all the possible known causes of recurrent miscarriage. Some of the tests that we will order include a chromosomal test, which is a blood test, to look to see if the woman or her partner harbors an inversion or a translocation, which is an abnormality within their chromosomes, which can lead to multiple miscarriages. Additional testing that would be requested include an evaluation of the uterine cavity, either with a hysterosalpingogram to check the shape and size of the uterus, or an office hysteroscopy to look for fibroids or polyps, which can interfere with a normal implantation process. We'll also evaluate the woman metabolically by checking her thyroid status, her prolactin status, making sure she's not diabetic, and making sure that her ovarian hormones are appropriate. Lifestyle changes are absolutely critical in the counseling and ongoing management of the couple with recurrent miscarriage. Some of the items that we focus on when we take our history of the couple is their alcohol intake, their weight, their amount of sleep that they get, which can interfere with their stress levels. We try to find out about their work background. Do they have a comfortable work environment? Are they satisfied at work, or they feel that they're under too much of a heavy load, which all can contribute towards an increase in stress hormones and may be a factor in their medical condition. There's no evidence that sexual activity will either promote or lead someone to have a miscarriage. And that is one of the things that we counsel couples, that it is important that they have a normal and healthy sexual activity together. One of the most difficult issues in dealing with recurrent miscarriages is the unspoken emotional toll that this takes on the couple, both on the female and to a different extent, but equally so, on the male partner. And as a physician, it's our obligation and responsibility to address those concerns as well, even though the patient may not fully articulate them. So our responsibility is to inquire as to how they're doing emotionally, to offer our own support, to stress to the couple that the majority of patients who do have miscarriages ultimately will have a healthy and successful pregnancy, and offer resources such as support groups, counseling, and alternative adjunct therapies that may help them cope through the stress of the recurrent miscarriage. It's important to emphasize that although recurrent miscarriage is devastating to most couples, the majority of them, with persistence, will conceive and carry a healthy pregnancy to term.